Allergies with Paul Rosen.
Our diets, our Western diets in America are just really, you just don't realize how poor they really are.
What would you say to others who would like to feel better?
Sometimes you need to find the instruction. That's where the testing and everything comes in, because without that knowledge, there's no way I could have got to the point where I'm at today.
Straight talk about health.
And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life.
With your host, Paul Rosen.
By the way, the information contained in this program is not approved by the FDA, nor intended to treat, diagnose, or claim to cure any medical condition or disease as defined by Western medicine. However, skilled practitioners of many disciplines have found nutrition response testing to be a highly reliable supportive technology for assessing the health and fitness of the body's functional system.
So maybe you spent the whole spring and winter hoping for summer, the warm weather, everything you can do throughout the summer, and you start things out by being miserable because you're having some kind of allergic reaction. What can you do? We'll tell you.
Well, let's start with the press and how it pumps the myth I call the pollen myth. Right? Here's a title of one article that I happened to come up on my in my email. Eyes burning, nose itching, blame the high grass pollen count in Portland right now.
The high grass pollen count.
High grass pollen count. In other words, it's the pollen. It's the pollen.
And in case anybody's wondering right now, that is the big myth, the big misconception about allergies. Going on, where are we? Yeah, it was 27 years. God, time flies. 27
when
years.
You're having fun.
What happened 27 years ago?
In 27 years of my practicing the work that I do here in Portland and Vancouver, I have not once found that pollen is the cause or the answer to solving the seasonal allergy equation.
But that being
not
the case,
once.
That being the case.
Now, let me just put a proviso in here, which basically says that I'm not saying there isn't someone out there who may be adversely affected by pollen. But what I'm saying is that in 27 years of practice, seeing a lot of people, many who have suffered from seasonal allergies from as long as 40 plus years to as little as a few, I've been extremely effective at helping deal with them without medications, not a one, and we'll talk about the potential side effects of those medications, and solved that equation, solved that seasonal allergy equation. And we'll hear from one of my patients who was a long-time seasonal allergy sufferer, as well as asthma. Asthma's, kind of that catch-all diagnosis that docs make for patients when they have trouble breathing, and it's not related to, say, an immune condition or a heart condition. They will call it asthma, shortness of breath, and the real cause is not pollen.
So we're going to find out what that real cause is. But first, a couple of things to address. One is, Paul, how has this big myth grown up around pollen? Why do we continue to believe that pollen is the cause of the allergic reactions we may have during spring and summer?
Well, number one, because, the press has pushed this idea. It's sort of like cholesterol is the cause of heart disease. Somebody comes up with a theory, gets some publicity, and, it catches fire. I guess we call it going viral now.
So it just snowballs.
In other words, they call it going viral because it is an immune, imposition.
It's that, or maybe you've answered my second question there. The second point to make is, if it's not pollen, what is the cause of allergies?
It's chemicals. That's the secret. Now, doesn't it make more sense I mean, how did all this come about? Why are there so many people who struggle during this time of year? Millions upon millions of people struggling this time. How did pollen, which, by the way, has been present on the planet for millions of years, and with which the human organism has grown up and evolved with, why now? Where was all the pollen sensitivity back 100 years ago?
I'm going to guess that it may have something to do with our industrial society. There
Thank
may be
you.
There may be something in our air now that was not there in past eras.
Thank you. And doesn't that make a lot more sense when you just take a moment to think about it, right? Because it turns out you don't have to have your head dunked in a bucket of Roundup to be adversely affected.
Well, I'm glad to hear that.
Yeah.
I really wasn't looking forward to that.
The body, your sensors are out there picking up on challenges which, at this stage of the game, we don't have technology to be able to identify. Does that mean that it's not there? Right? That'd be like saying, before we had the ability to differentiate the different wavelengths of light, that until we had a tool to do that, it didn't exist. It wasn't there. UV light, infrared light, in other words, light beyond the visible spectrum.
Also, gravity did not exist before we could name it, right?
There you go. People were floating off the planet like regularly.
And that's how we kept our population really regulated.
No. Science is the study of natural phenomenon, right? And then trying to understand it, maybe even manipulate it to our advantage, right? But up until now, we don't have a machine, right? a technology that can identify the small, very small particles of agricultural chemicals, of industrial chemicals that can and do impact every human organism that comes in contact with them. Of course, depending on that organism, the health of that organism, the genetic makeup of that organism, the sensitivity of that organism, it may or may not reveal via symptoms that you experience. 'Cause not everybody experiences this toxicity in the same way.
So each of us is an individual organism, as you put it, and as you just said, we're going to react to the things in the air differently.
My wife has gotten to the point now where she can't even walk down and clip her own roses in the backyard without having blowback from the existence of these chemicals. And she's extremely sensitive, more so than most people, but it has nothing to do with pollen. Why? Why do I know this? And how can I know this if there's no technology to be able to determine that it's even present?
So I'm guessing maybe there is a technology.
There is, and that's the muscle testing. That's the nutrition response testing technology that I use to evaluate and find the environmental impingements that are preventing a body from functioning normally, because runny eyes, itchy eyes, runny nose, sneezing, increased heart rate, headaches, these are some of the symptoms that people who have seasonal allergies experience, right? Indicates that the person who's experiencing these is not regulating normally. Their autonomic nervous systems are not handling well or are being obstructed from normal operations.
So here's what many people may do. And in fact, when I was out in about the past week or so in Portland, it was a symphony of runny noses and sneezing and all that. You can see it all around you. Go down to the bus mall and you see a lot of people having these kinds of problems. So somebody may be aware of that. They may think there are environmental things going on that are making me miserable. They're probably going to say it's pollen, and they're wrong about that, as we've established. But they'll go inside, and being inside, maybe they'll experience some relief, or maybe not, because aren't there also things in our homes which can have similar effects?
Absolutely. One of the most overwhelming endocrine disrupting chemicals around is the laundry detergent scents, the dryer sheet scents. Get them out of your life. Don't ever buy anything that's scented again. If you want to smell something that's really comfortable and makes you feel good, use organic essential oils. Now, every person doesn't, again, do well with certain scents. The whole essential oil craze nowadays. These oils do have an effect on your autonomic nervous system, your endocrine system as well. So you'd want to know which ones would do well without having access to somebody like me to be able to muscle test them for you. Start with the citrus oils like the orange, the lemon, the lime. Vanilla is another one that you can use. People who are, the craze to use lavender and tea tree oil and whatnot. More people will have adverse reactions to them, causing their thyroids to become hyperactive. Then we'll actually get along with them well,
So you're saying, though, Paul, to backtrack a moment, those scents we use in our dryers in particular, somebody wants that authentic pine smell.
Killer.
So they just toss in that little that sheet, as you put it.
Right.
Right. But what about what do they call it? The stuff that's supposed to take out the static. You put that in when you dry your clothes.
Well, I think that's one of the types of sheets, isn't it?
Right. Yeah. You just toss that in
Just
there.
use unscented if you need to use, if you feel like you need to use one. They make unscented products now. Use them.
So I'm guessing also that could get into your clothes while you're,
Absolutely.
using that process. You're going to take it with you.
I can't take a walk in my neighborhood without smelling somebody's laundry. It's horrible. I mean, really. It's insane. It's like, and people think there's no problem with it, that it's just fine. I mean, what are you talking about? Everybody does it.
Well, maybe that brings up the point, too. Yes, everybody does it, but it's also something we do casually. We don't give it that much thought. We say, I want this anti-static device, and that sounds good to me. Whoa, what was that?
I don't know.
You just get an email?
I don't. I just got the hook.
Okay, somebody's no, it wasn't the hook. It's just somebody contacting us, I think.
I think it would be good to, at this point, just to introduce Julia.
Okay.
My patient was kind enough to do an interview with me at an earlier time, and let's set the stage here with her, because I think her story is indicative of most. At least that's been my clinical experience. So, part one. Julia is a patient of mine, and I've been working with her for a while, and she consented to share her experience with respect to utilizing the nutrition response testing, and I think getting her on the road to changing her life. Would that be fair?
I think that's an understatement, actually.
So how are you this morning, dear?
I feel just great, thank you.
Oh, that's great. I mean, who could not with this weather, huh?
Absolutely. It's been pretty amazing given the spring that we've had.
Oh my goodness, it's like not just a breath of fresh air, but a respite in what seems to be a siege of trying to maintain one's good nature in all of our rain. But let's get to the topic at hand. So, how did you come to utilize nutrition response testing in the first place? I mean,
What started it for me actually was driving back from Seattle. I happened to hear your radio broadcast, And that led me to, and I didn't hear the first part, so at the ending, I had to get the name of AccuNaturals, and then I went online to do a little research and searched the internet just about nutritional response training and health in general, and that led me to one of your seminars.
Aha. And talk about that. Was the seminar interesting to you? Was it worthwhile, and why?
Definitely. And the reason being is that everybody has different issues that they're dealing with. And I think that a lot of people, particularly those that would come to a seminar about diet and health, are searching for answers, maybe an alternative to what they've experienced in Western medicine in general. So it was really good just from the standpoint of everything was succinct. It was easy to understand. Everybody has sort of different issues, but they all sort of relate. And just hearing other people's stories as well as being able to share mine was enlightening. And then your responses, of course, were intriguing and helpful. So that caused me to do further research. And then by the end of the seminar, I was convinced that I was going to go in for an evaluation, and so I did shortly after the seminar.
So what did you hear? You've said some really inspirational things. What did you hear that got you inspired? To take action. To actually do something.
Well, I think that for me personally, it was the knowledge that I was on medication, had been for a long time.
How long?
In excess of 20 years.
Wow.
And, the handwriting was sort of on the wall that I knew as I got older that I would be increasing the dosage. At least that's what my doctor was telling me. And so...
he's right. He's correct.
I was looking for something else. And hearing you speak about, how everything sort of ties into diet and sugar and other things, really seems like it was just the right information at the right time for me. I had
Gotcha.
kind of, my journey had sort of led me up to you, and you just kind of had the missing pieces for me.
And because you had done some other things. You weren't. I know you weren't just sitting still. You were on medications because, of course, you were suffering, and you'll tell us what you were suffering from in a moment. But you were on these medications, and you had been looking for other things. Did you try some other types of intervention?
Absolutely. And I had actually done my own personal detox some years back, trying to just wean myself off sugar, white flour, a couple of other things.
Yeah.
And it was a miserable experience. It took me, I would have to say, maybe 2 months to get to where I felt good. And I really felt bad in that interim. So that wasn't, that was something that I was sort of looking forward to with a little bit of concern, because I knew that wasn't easy. At least it wasn't before.
That's Julia, Paul's patient. We're hearing her story, how she got on the road to better health with her problems. Speaking of environmental hazards, Paul, I know back in the day, like the 19th century I'm speaking of, doctors used to send their patients with TB, tuberculosis, to dry climates, thinking that would help cure them. In fact, that's how Doc Holliday ended up in Arizona. That's where his doctor sent him. Raise your hand if you care. I'm raising my hand. That makes one. Okay. But that does bring up that point. That does bring up that point that your environment can have a huge impact on your health.
Well, yeah. There's no doubt about that. But for you folks, for anybody out there who actually wants to address the root cause of your seasonal allergies and be freed from the side effects of your antihistamines, or if you're contemplating injection therapy, completely avoid that entirely, or the side effects of the anti-inflammatories like Tylenol and Advil, which put your kidneys and or liver in jeopardy, or aspirin, which puts your cardiovascular system in jeopardy, or the corticosteroids like Nasonex or Flonase, that's pretty common brands. And these put your immune system in jeopardy. And of course, the ever-present OxyContin, which is a full-blown narcotic, which potentially might make you an addict. These are all of the medications, including antacids, because one of the side effects, of course, is a sour stomach, like Prilosec or Zantac, which don't address the root cause, never have addressed the root cause, will never address the root cause of acid reflux. And then the emotional component that comes along, the where a person doesn't just experience, runny nose or itchy eyes. They feel, blue, depressed, or irritable.
Which can only exacerbate the condition. I mean, if you're not in a good mood, if you're depressed, I would think that's only going to make your body more susceptible to more rotten things that are going to further ruin your health.
And then the over-the-counter or prescription medications to help a person sleep, because these chemicals disrupt the normal thyroid function, which disrupts your normal sleep pattern.
So I think there's a tendency, as always, to reach for the immediate relief. And tell me if I'm wrong, you can correct me. These medications may provide that. They may give you a quick fix for your sneezing, your runny nose, what have you. But the next day, you're right back where you started.
Well, there's a quicker fix, actually, as it turns out. There's a quicker fix.
A quicker fix.
Yeah, there's a quicker fix than medications.
Which is?
And that is getting yourself a nutritional healing program and identifying which chemicals and what tool or tools, just like Julia now does. All right? So, yeah, it's a complete misdirection. It's a myth. It's not pollen. Never was. For the overwhelming super majority of people, it's only chemicals. And we can identify specifically what tools. No side effects whatsoever. None. Zero. Zip. And you're on the way, once and for all.
So we've mentioned detergents and things like that, which can be in our homes, which can make conditions worse. Are there any other things?
Well, the detergents are just simply, a pile-on chemical. The people's sensitivities can be exacerbated. They get worse. The more chemicals, the more disruptors to your body's normal function, the more likely you get to that tipping point where the body can't accommodate anymore. And then it starts, throwing all kinds of error codes.
Error codes in the form of these symptoms?
In the form of breakdown.
Okay, so you'll
functional breakdown.
You'll have symptoms which are worse, and maybe without you even knowing it, as you just said, you're having more serious issues internally.
Who out there, right now, listening? Who out there has, asthmatic or seasonal allergy condition?
Well, I can tell you this, Paul. I actually get these heavy sneezing fits that I have sometimes, and I can't really identify a pattern. It's not when I enter a certain building. It's not when I enter home necessarily, but I'll just have these huge sneezing fits. I mean, you can hear me around the block. In fact, I'm surprised moose don't show up, thinking it's mating season once I get into one of these sneezing fits. Yeah, it's pretty bad. It's pretty rough. Don't do that.
The moose.
I don't want them around here. Thank you for the effort.
Get out of here. Go away.
What can that be? Do you think that's maybe an environmental
thing
going on?
Absolutely. It's definitely an environmental thing. Yeah, you bet. Guaranteed.
Okay.
Guaranteed.
Then
I don't know. I can't, without evaluating you, I wouldn't know specifically which environmental impingement it might be. But nevertheless, it is guaranteed.
Right.